Diagnostic techniques, treatments, and procedures. Babinski's reflex. Reflex is tested by stroking the sole of the foot, beginning at the mid-heel and moving upward and lateral to the toes. Positive Babinski occurs when there is dorsiflexion of the great toe and fanning of the other toes. Normal reflex in newborns, abnormal if noted in children or adults. Brain scan. Nuclear counter-scanning of cranial contents 2 hours after an intravenous injection of radioisotopes. Isotopes concentrate in abnormal tissue of the brain, indicating a pathological process. Cerebral angiography. Visualization of the cerebral vascular system via X-ray after injection of a radiopaic contrast medium into an arterial blood vessel. May use carotid, femoral, or brachial artery. Cerebrospinal fluid analysis. Laboratory analyzes the cerebrospinal fluid obtained from a lumbar puncture for the presence of bacteria, blood, malignant cells, and amount of protein and glucose present. CT scan of the brain. Analysis of a three-dimensional view of the brain tissue obtained as X-ray beams pass through successive horizontal layers of the brain. CT also means computerized tomography. Images took down through from the top of the head. Cordotomy. Neurological procedure for pain control accomplished through a laminectomy. Surgical interference of pathways within the spinal cord for control of pain. Cisternal puncture. Insertion of a short beveled spinal needle into cisterna magna in order to drain cerebrospinal fluid or to obtain a cerebrospinal fluid specimen. Cisterna magna, the shallow reservoir of cerebrospinal fluid between the medulla and the cerebellum. Craniotomy, a surgical procedure that makes an opening into the skull. Echoencephalography, analyzing intracranial structures of the brain with the use of ultrasound. Electroencephalography, that's the EEG, measurement of the electrical activity in the brain and recorded through electrodes. Sleep-deprived EEG is an individual deprived of sleep for 24 hours before the test. Ambulatory EEG provides prolonged readings of electrical activity of the brain over a 24-hour period of time while the person is awake or asleep. Electromyography, EMG, process of recording electrical activity of muscles. Insert a small needle into the muscle, deliver a small current that stimulates the muscle. Laminectomy, surgical removal of the bony arches from one or more vertebrae in order to relieve pressure from the spinal cord. Lumbar puncture, insertion of a hollow needle and stylet into the subarachnoid space between the third and fourth lumbar vertebrae below level of the spinal cord. Performed under strict antiseptic technique, invaluable in diagnosis of meningitis, brain tumors, spinal cord tumors, encephalitis, and cerebral bleeding. Magnetic resonance imaging, also known as an MRI, is a non-invasive scanning procedure that provides visualization of fluid, soft tissue, and bony structures without the use of radiation. It provides far more preciseness and accuracy than most diagnostic tools, and is not limited to scans of the brain. May also be used to examine the abdomen, chest, joints, nervous system, pelvis, and spinal column. Myelography, introduction of contrast medium into the lumbar subarachnoid space through a lumbar puncture in order to visualize the spinal cord and vertebral canal through X-ray examination. Neuroectomy, neurosurgical procedure to relieve pain in a localized area by incision of cranial or peripheral nerves, interrupting tracts of the nervous system that relay pain sensation from point of origin to the brain. Polysomnogram, sleep study or sleep test that evaluates physical factors affecting sleep. Physical activity and level of sleep are monitored by a technician while the patient sleeps. It's useful in evaluating sleep disorders such as sleep apnea, sleepwalking, night terrors, restless leg syndrome, insomnia, and narcolepsy. Positron emission tomography, also known as the PET scan, computerized radiographic images of various body structures produced when radioactive substances are inhaled or injected, useful in showing metabolic activity of the brain and other body structures. Romberg test, examination used to evaluate cerebellar functions and balance. Stereotactic neurosurgery, Neurosurgery on a precise location of an area within the brain that controls specific function or function may involve destruction of brain tissue with various agents such as heat, cold, sclerosing, or corrosive fluids. Sympathectomy, a surgical procedure used to interrupt a portion of the sympathetic nerve pathway for the purpose of relieving chronic pain. Tractotomy. Through a craniotomy, the anterolateral pathway in the brainstem is surgically divided in an attempt to relieve pain. Transcutaneous electrical nerve stimulation, also known as TENS, form of cutaneous stimulation for pain relief that supplies electrical impulses to nerve endings of a nerve close to the pain site. Question: which test might be ordered for determining the electrical activity of a muscle? A. Magnetic resonance imaging. B. Electroencephalogram. C. Electromyography. Or D. Polysomnography. The correct answer is C. Electromyography records electrical activity of muscles. Remember, myo means muscle. That concludes part 3. Please refer to Blackboard Assignments tab for all assignments that are due this week. Thank you.